My name is Jessica Taylor, and I will be telling you what HIPAA is and what I can do to prevent a HIPAA violation. So I'll first explain what HIPAA is. It is the Health Insurance Portability and Accountability Act. It was passed in 1996, and essentially what it did is it made it illegal for a patient's protected health information to be accessed or shared for any reasons outside of healthcare delivery operations or reimbursement, such as billing. Legislation surrounding this act mandates the controls regarding transfer from entities or any violations. And this is all per our textbook, Shi and Singh. So what can I do? When I initially saw this question about what I can do to prevent a HIPAA violation, the first thing that came to mind are the obvious things, such as securing my password and not sharing it, locking the workstation anytime I'm away from it, or not leaving patients' protected health information up on the screen, and then making sure that the patient's documents or any other files for them are properly secured. But I kind of wanted to speak on something that I specifically do in my work area. And so two things I'll be discussing that I specifically do. So when we have new patients come into our department, we inquire about the status of their healthcare power of attorneys or any other legal documents that might okay for their information to be shared. And if the patients do have these already on file with an attorney, we ask for a copy to be provided so that we can have it scanned into the chart so that it appears in our electronic health record. If the patient does not have this but does desire for a family member to be involved in their care or have access to their health information, we have a form that is called an involvement of care form. I'm not sure if other facilities have this, but we do have it at my facility, and it allows the patient to list either an individual or multiple individuals who they are okay with their healthcare team discussing their care with. And so this is something that can prevent a HIPAA violation from occurring, because we oftentimes have family members that will call and inquire on the health status of the patient, disease progression, treatment options, and they may not be calling with the permission of the patient. And so this allows us to be able to say, hey, your loved one needs to fill out this involvement of care form. And then once we have that on file, we can proceed with giving you any requested information. This form can also be sent to patients electronically through the health portal, so it does not require them to come in for an additional visit if this is something that comes up when they are outside of the clinic space. So I'm going to tell you about a scenario that actually happened on Wednesday of this week. We had a patient that came in. She's from Mississippi. She was present with her daughter, and she informed me that she had two other children, another daughter and a son, and that no information could be shared with them because she had decided that it was best not to disclose her diagnosis to them. She informed them that the biopsy she received was benign, although her biopsy demonstrated that she had malignant primary peritoneal cancer and had quite advanced disease. But she said her daughter lived in Texas and would be so worried about her that she would move back to this very rural town in Mississippi, which the patient feels has nothing to offer her, and she felt like it would be career suicide for her daughter. And she said her son struggles with alcohol addiction in the past and has been sober for 1 year, and she felt like if she gave him this devastating news, it would jeopardize his sobriety. So this is not an uncommon occurrence in the oncology space that I work in. We have patients that tell their family members various reasons of why they have lost their hair or they might be losing weight based on treatment responses because they've decided that they don't want to disclose this information. And generally it's the reason is because they want to protect their loved ones from their diagnosis, and they're afraid that their loved ones won't be able to accept it or it'll be devastating for them. And so this is what I can do to prevent a HIPAA violation, is to continue to not discuss this information with family members unless we have the necessary